So, ladies and gentlemen, distinguished guests and the faculty members, a warm welcome to all and welcome to GIBS IRE Talks. Today, I'm Professor Sandeep Bansali and it's my honor to serve you as a host for today's event. So, before we begin, please allow me to introduce you all to GIBS. GIBS Business School Bangalore is an esteemed institution managed by Goel Educational Trust, and we are located in Bangalore. GIBS offers AICTE Approved PGDM Program and BBA from Bangalore University, providing students with comprehensive education. The GIBS boasts an exceptional faculty known for its mentorship as well as the focus on practical learning. At GIBS, we are committed to prepare the students for the industry through programs such as GIBS Finishing School, the IRE School, which enhances their skills and knowledge. Additionally, GIBS also has a remarkable track record of placing its students in top-notch organizations, ensuring a bright and a career prospect. At GIBS, we strive to cultivate an environment that fosters innovation, research, and entrepreneurship. Our mission is to empower individuals like you to reach their full potential, both personally as well as professionally. We aim to develop a strong leadership skills, facilitate valuable networking opportunities, and provide an active engagement within our communities. Today, we are honored to have a true inspiration in the field of entrepreneurship as a keynote speaker, Mr. Arun Agarwal, the CEO and founder of highly successful Bangalore-based startup Janitri Innovations. Thank you so much, Arun sir, for joining us. And it's our privilege that you are with us today to enlighten all of us with your expertise in the field of medical.
Thank you, Mr. Sandeep, for inviting me. It's my pleasure. I definitely wanted this, if it could be, physical one-on-one, because that is where you can have a lot of interaction with the students.
We will do that, sir.
Maybe next time.
Certainly, we'll do that since you're also from Bangalore. So we have more opportunities to call you to the campus. So before we begin, proceed further, please allow me to share a few words about you so that the audience get to know what Janitri is all about, what Agarwal sir is all about. So please allow me to share your few details about you.
Yep.
So Mr. Agarwal is an expertise and experiences will undoubtedly help all of us with the invaluable insights in the journey of medtech entrepreneur and lessons learned a long way about this journey. And today's topic is the journey and the learning of medtech entrepreneurship. So Mr. Arun Agarwal is a biomedical engineer and an entrepreneur based in India. He has earned BTech in Electronics Engineering and MTech in Biomedical Engineering from Bangalore Institute of Technology, that's VIT, where he has developed a strong interest in the healthcare innovation. After starting his career as a patent analyst at one of the renowned organizations in Gurugram, he has founded Janitri Innovations in 2016, a medical device startup focused on improving maternal healthcare. Mr. Arun is passionate about using technology to solve real-world problems and make a positive impact on society. Through his work at Janitri, he has been able to develop an innovation medical devices that can create a real difference in maternal and neonatal healthcare. Mr. Arun's achievements as a social entrepreneur and innovator are impressive. In 2015, Janitri Innovations won a biotechnology ignition grant, that's BIG, from Biotechnology Industry Research Assistant Council, that is BIRAC, to develop a wearable device for continuous monitoring of fetal heart rate and uterine contractions during labor. This was a significant accomplishment, as a big grant is highly competitive and recognizes only the most promising and innovative biotech startups in India. Over the period, with the help of Janitri devices, more than 50,000 plus pregnancies have been monitored in 250 plus hospitals in India and across the globe using the Janitri's fetal maternity monitors. This demonstrates the impact of Mr. Arun's work and the effectiveness of Janitri medical devices in improving the maternal and neonatal health outcomes. So Mr. Arun have also been selected for several prestigious programs that provides funding, mentorship, networking opportunities to the entrepreneurs. In 2017, he was also been selected for the Evaluate 100 programs by the Karnataka government, which provides funding and mentorship startups in the state. In 2020, he has received a funding from Social Alpha and Will Grow Innovation Foundation, two prominent incubators for social impact startups in India. He has also received the funding from COVID-19 Ignition Grants Program by Indo-US Science and Technology Forum, that is IUSSTF, which provides support for the startups developing solutions to the pandemic. And I must say that I'm sure a lot of us would have seen Mr. Arun also on the Shark Tank India, where he had secured a funding of 1 CR from Ms. Namita, a prominent businesswoman and investor. And this is the testament to the innovation work Mr. Arun and his team is doing at the Janitri Innovations. I must say there are a lot of things. Your profile is quite long, Mr. Arun, but I'm apologizing that I'm just cutting it short and put it across. So over to you, sir. And one last thing for all the participants. Any doubts, any questions, anything you want to know more from Mr. Arun, you can please put it in the Q&A. We will surely take it at the end of this session. Over to you, sir.
Thank you, Sandeep, for this warm introduction. Before I go ahead, would love to know the background of the students. So what field they are in, if I can get some idea.
We have a mixed blend of audience. A lot of them are from industry, a lot of them are students, a lot of them are from the faculty, education industry or the faculties, So it's going to be a mixed blend of audience what we have. So I would request the audience if you can just put in the industry you're from in, so that on a later while probably we can just go through that.
Yeah, I request if you can just put a single word from which background or which industry you are. It will give me an idea, and then I can accordingly talk about my learnings and how it can be beneficial to you, and also the whole story.
Great.
Do they have an option to put this? Okay.
In the Q&A section, a lot of them have put in education sector, management, commerce. I'm from a space of education. Dr. Girish, an academician. We have Sheikh Feroz, who's pursuing his MBA. We have commerce stream. So moreover, management students and the fraternity from the education fraternity, sir.
Wonderful. And they're all students, or they're also professionals?
They are also professionals, sir. We have somebody, Mr. Samir from BFSI from the insurance industry. So there are professors as well as students as well.
Got it. Great. I think it will be my pleasure to share my story and also the learning, because that is important, where that is what I am also doing, hearing these stories. Hello.
Arun sir, there is a lag in the internet from your end.
Can you hear me?
Yes, now I can hear you. Things are fine.
Yeah, so what I was saying is I can also share my journey. But hi, everyone. This is Arun, founder of Janitri Innovation. Probably you might have seen me in the Shark Tank Season 2, where we have raised money investment from Namita Thapar. But yeah, to start with, I can only share the journey, the challenges, experience, which might be beneficial for you to start your journey, or if you're already doing what you can do. So I come from a small town from Rajasthan. It's called Alwar. I have done all my schooling there until class 12th. And but unfortunately, I was not having a lot of exposure there. It's a tier 3 city. And used to hear a lot of problems around healthcare or any other sector. But those were the stories for you as your early childhood. You cannot do anything, and you cannot even think how to solve it because you do not have an exposure. Like other people, I also started fighting for IIT. Unfortunately, I did not get, but ended up into VIT Vellore. So straight away from Rajasthan to Tamil Nadu, VIT Vellore, I got an admission into Bachelor's in Electronics. And that is where now I started seeing the world. Okay, how the technology is working. With a lot of exposure was there. VIT Vellore is a prestigious university. And I started getting that lot of exposure, curiosity, how sensors are working, how mechanical is working, how electronics is working, computer is working and all. And that started giving me a lot of exposure. And, then one day we saw in the first month itself, we saw that some seniors was making the robots, some robotics related competition was going on, and that catches my eye. What is that? And seems like it was interesting. Right? Robot itself is a very curiosity and very interesting field. And since then asked my two friends, like, let's participate in this competition. Let's make robot. So I think one definitely, as a founder, I would say that curiosity has to be on the top if you really want to keep solving the challenges. Your curiosity really makes a lot of difference, and that is how the curiosity also comes down to your team member. So yeah, we started doing robotics in first year. We participated in a lot of robotics competition across the country, including IIT, BITS and all. Won a couple of national competition. And until the end of first year, we were a little bit of having some expertise of making some robots. We started knowing, okay, there is a team, including Arun, who are making robots and participating and winning. And when we came in second year, interestingly, our first year juniors have started asking us, we also want to participate in a robotics competition. This looks interesting. Why don't you teach us? And that is where, as an Agarwal, I see an opportunity. Okay, now the people are asking how to make a robot, and a lot of requests are coming. So that means there is an opportunity here. And me with two of my other friends, we thought, let's teach robots, and why, let's make some sort of a business out of it. And we started doing that. So my first startup actually started from there. So started from my second year of my BTech. That was my first journey as an entrepreneur. And we started teaching robotics to a lot of school and college students. We started having revenues. We started 1 day, 2 day workshop from manual robotics to the ultimately line follower robotics. And in 3 years, I'm talking about my college life, second year, third year, and final year, 4 year. So in 3 years, that time, as a student, we did 60 lakhs of revenue. And that at least gave me a satisfaction in terms of that, yes, this is something I'm liking as an entrepreneur, and I'm good at executions, able to work with the team, and I started realizing that, yes, I can do that. But yeah, the DNA comes from the business because my family was in business. So definitely that comes from there. But now what happens? There was a learning there. When you do that, then you started realizing what do you like and what you don't like. So as a founder, I started realizing that I'm liking the entrepreneurial journey. I'm liking doing business. And but at the same time, I also want to do something very, very impactful, which can be solved through deep tech. And my first startup into robotics education was not giving me that, because it was a hobby education and it was not making an impact. And it was not a deep tech, it was an education. And that is where I took the decision in life that, okay, I think this is something which my criteria are not getting fulfilled. And I started thinking about it and realized that I can do something in healthcare. There are a lot of challenges in healthcare. I started connecting some dots through my childhood memory, and started thinking that, yes, deep tech can solve global healthcare problem. And straight away, without thinking anything, I have taken admission into Masters in Biomedical Engineering to understand that how technology is working in healthcare ultimately, and to take that sort of an experience of developing an healthcare product. And yes, it took me 2 years. Overall, it was a 2-year course. And ultimately, at the end of final year, I again came to a point, okay, now healthcare is big. What is that one problem I should take it ahead through my entrepreneurial journey? And again, because without identifying the problem, you just cannot start something, right? So you have to be very, very clear on the problem and its market size and its affordability, viability, everything. So what I started doing, I had to survive myself financially. So I've taken a job at eValueServe as a patent analyst. That was by chance. It was not by choice. But at the same time, I've started doing a deep research in healthcare related problems. In terms of, I started meeting doctors, started attending conferences, started attending healthcare hackathons, started attending going hospitals. So ultimately, that's the way you start doing your primary and secondary research in healthcare. And from there, it got narrowed down to mother and child healthcare, that, okay, this is the global related challenges. A lot of solutions can come. You can make an impact and you can make a business out of it. And as soon as that was clear, okay, there's something can be done in mother and child healthcare, straight away, I have decided to move from Gurgaon to Bangalore and left the job, and ultimately took another 6 months to go deeper into mother and child healthcare, decided one problem statement in that, and then registered Janitri. So that is the day one of registering the Janitri. That is how I have started thinking about doing Janitri. So what exactly helped me here is, so that deep problem identification and validation, which I have done almost for 1.5, 2 years, where I have met a lot of stakeholders of my field, which are gynecologist, pediatrician, mothers, family, expectant mother, nurse, very thoroughly across the country. So that deep problem identification and validation is very, very important if you are planning to start something. Because a lot of time what happens as an engineer, we have solutions in our mind because we think in that way. And we try to put the solutions on the problem and we get failed. So, I mean, we should do ulta. Without having the solution in mind, do a thorough research on the problem. That is much needed. I mean, if you are highly confident on the problem with your research, with your intention, with your guts, solution you can develop and then it will be scalable. So this is my first learning, and that really, so that phase of doing problem validation very thoroughly is still helping me. It's been almost 7 years. It is still helping me because I understand my each and every stakeholder very well. I have seen this whole journey as an engineer. I have seen live deliveries. I have seen C-section. I have seen what's happening in the pregnancy, after delivery, during delivery. So I know each and everything like a doctor, that, okay, this is what's happening. And accordingly, you can develop the solution, or you can give an idea to your tech team or the business team or the marketing team. So this is very important. I mean, you can take 6 months to 1 year to just validate your problem. Now, when there was a problem has been defined, now I had to develop the solution. So problem validation is one part. Okay, this is a problem. The second step, which also I have learned from other expertise or experience, is the solution validation. And you really do not need to actually develop the actual product to actually validate it in terms of the need of it. So, what I did, as soon as that problem was clear, on just a normal paper, I've just sketches the solution. Okay, this is the feature I want, and this is how it will, imaginary how it will look like. And again, went back to these stakeholders again, where I have validated the problem and told them, this is the problem you are facing. They said, yes. If I give you this, how it will solve it? And then they come back to us, okay, yes, it is helpful and we are ready to pay for it. Just on a paper, right? Because I just cannot develop a medical device in 1 day. So that solution validation is also something very extensively I have done just on a paper before even taken this step 1 towards developing the medical device. So we called it as a solution validation on a paper, just an idea solution validation. And then you start building the concept or a first POC, or we call it as an MVP or POC, proof of concept, or a minimum viable product, that you have to define based on your industry. But specifically in medtech, there are very, very few investors who actually invest in the early stage, because it's a very high risk. You have to go through the development, you have to go through the clinical trial, you have to go through the regulatory approvals, and then only you will be able to start selling in the market. So from an idea stage to the commercial launch, this is 4 to 5 journey, specific 4 to 5 year of journey. Specifically from the medical device perspective, it could be different from for different industry. And there are very few investors because the journey is long, it's high risk, it's a new research. So you have to, but ultimately you need money to make it. And that is where we have started started taking the grants from the different organizations, started applying grants from the different organizations. Which includes, we have received grants from BIRAC, Government of India, Bill and Melinda Gates Foundation, Government of Karnataka, Government of Canada, Will Grow, and they have supported us in our early journey. But here is also important point, like the people you have validated the problem or the organization, then they are the same people you have validated your solution concept on a paper. Now they are the same people who will also do your early pilot of your first product. So I mean, that is something very important in terms of relation. Like you have to make those relations with them from the day one, from the problem validation to the solution validation, and then further doing the pilot of your product or clinical trials of your product. So now when we were ready with our first POC, we again went back to them and said, okay, now we want to try that in your facility, please, and then proper ethical approval you have to take, and then try it on a patient, and then further improve it based on that. So we have done that. Multiple iteration has been done. And then those are the people who further become your early customers too. Because they said they have accepted the problem. They said, yes, if I get that solution, I will take it. They have only validated in terms of clinical trial, and when it is ready to buy, they becomes early customer. So now you can, as a founder, you can definitely give them a lot of discount because they are your early customer. But those are important of your whole journey ultimately. From those early customers really matters a lot. So in our medtech journey, definitely, in our specifically case, our early customers are gynecologists, hospitals, NGOs who are also running the primary healthcare centers and all. So we have deployed our early product there, got a lot of data, a lot of feedback, and have further improved based on that. And then we started scaling up in the market. But now the time has come where the grants are not there for scale up. It is only for the idea to POC or building the product. And then you need a money for regulatory approvals and further commercialization, manufacturing, marketing capability. And that is where we actually managed to raise funding from Singapore-based fund, and they invested as a first fund. So that helped us in getting the approvals and further taking the first market entry and do the product market fit in terms of feature and money. And further, when we started doing early revenue, and then that is where the whole horizon of investors get open, because now a lot of de-risking has been done already. And now they can support you for the further journey of scale up of your product, because now you're already in the revenue stage. So now that is what we are in. We have closed our recent round as well, which includes Shark Tank Namita as well in that particular round, which was in the range of around $1.1 million. But overall, if I look at my last 7-8 years of journey, I can quickly say these points, like strong problem validation is important. I always say to all the people that if you have 1 hour, let's suppose, to validate a problem and just to build a solution, spend your 55 minutes in validating the problem and just 5 minutes in building the solution, because it will become that obvious. The relationship building from day one is important from your end customer or consumer, because the people who are you doing validation, they will become your early customers too. And a lot of time, you have to define your MVP. What is your minimum viable product? Because what we keep thinking is, okay, let's bring that feature, let's make it more, smart. Let's bring that and all before even launching. So, I mean, you should know that, okay, this is the minimum viable product or basic feature which people are ready to use it and ready to pay for it. And do not wait for the ideal product, because ideal product cannot come. It will not come. It will keep coming. You will keep improving. So just define your MVP, go in the market as early as possible and start getting revenue, because money from the customer hitting the account is the actual validation. Now, all other validation is completely fine. Problem, solution, again, clinical trial and all, but actual business validation or company validation is when customer money hit your account. Even the investor money is not the actual validation. Yeah. So that is what we believe. And then that is what we have done. As soon as we have our MVP and we have a regulatory approvals on that, we started promoting in whatever capacity we had. And we were having early customers because of that. And we started taking feedback from them to make sure that we improve and further started promoting. Now in this journey, so I'm a solo founder, and this questions keeps coming that pros and cons versus solo versus multiple co-founder. I think both has its own pros and cons. As a solo founder, it's all your decision ultimately, whether things goes right or wrong. You have to take the ownership. There's nothing, you do not have anyone who will take your things on ego, or anyone, right? In multiple co-founders, it's like, you have to marry the other co-founder, because it's a very, very sensitive, and if any co-founder left, it becomes also red flag. But at the same time, if there is a very strong chemistry, it is really helpful. And if you guys complement each other, have the similar kind of a passion and vision, have a strong chemistry, no ego to each other. And so that's definitely a great point. But, it's how you are going to find the similar kind of a person like you who is equally passionate like you. So team is definitely important. For example, in my case, I was a solo founder. So I have created the second layer of management team who are like this. Somebody is taking care of the product. Somebody is taking care of the regulatory. Somebody is taking care of the clinical research. Somebody is taking care of the business. Somebody is taking care of the CSR. So, I mean, that we have created the second layer of it. Now, specifically, if I come to a point of further scale up, because you have taken the journey from 0 to 1, now 1 to 10, or then 10 to 100, the whole dynamics and the thought process get changed and evolve over the period of time. And you have to keep thinking as a founder what you have to bring. So when you are in a 0 to 1 journey, then you have to start thinking that, okay, what you have to now start thinking about 1 to 10 journey. So when you are in a 1 to 10 journey, then you have to start thinking about what you need from the 10 to 100 journey, because your existing team will be occupy in the day-to-day based operation in executing that particular journey. So it is very important to look at from that perspective. So now, yeah, altogether, definitely the Shark Tank has given us that kick. Ultimately, whatever that kick is needed for a startup, but it has to be maintained enough. So we are doing everything, but definitely that has given the kick. So from that perspective also, if anybody is already having a startup and planning to go or apply for Shark Tank, I would say that if you're already in the market, if you're already having revenue, then only apply and go. It will benefit you like anything. Please do not go if you do not have the product, or if you are not ready in terms of scale up. because it will not then help you a lot. So that is one of the learning which we had. So we were already in the market. It came on the right time. And that has given us that sort of a kick, and trying to maintain that particular kick and bringing more products. But yeah, overall, medtech is definitely hard. But it's a high risk, high gain industry. It's a little bit of time taking. It needs some patience if you're planning to come in that particular domain as a startup. But I would say that I can instead of 15 minutes, I would love to make it more interactive. And instead of 15 minutes, we can have 30 minutes for question and answer, because a lot of questions are going to come.
Certainly, yes, sir. We'll do that. I must say that there are a lot of questions are already there. The responses we have received it. So let's take up the first question what we have received at this point of time. Joy Thomas asks, he says, sir, what motivated you to become a medtech entrepreneur?
Yeah, I mean, very interesting question. And why, as a person, I have decided to go on the harder path as an entrepreneur. So for some reason, there was some sort of a childhood memories where I have seen some healthcare challenges in and around family, neighbors and all. The another is sort of a social, which also has come up from the family, where I really wanted to do something which can make an impact. Number three is something which is in Make in India. So I'm a hard believer of Make in India. If we can develop something from India, why we are importing everything. So I think all these factors which are really, I enjoy, I get motivated by these factors. So these are the couple of reasons why I have decided, okay, let's develop medtech from India. It will take time, but yes, it will come. Somebody has to take the leap.
Absolutely, sir. Thank you so much for that. So they always say, there's one nice saying in English which says, Rome was not built in a day. So as you rightly said, that you had put it down, your thoughts, your problem validation, which you emphasize so much on, that put things on paper first, rework on it, validate your problem, and then get into it. So as you rightly said, there will be a time where you will get an opportunity to encash yourself. So moving ahead with the next question, this has been asked by Ranjan Kumar. He says, sir, how do you think in the future of healthcare in India? I am the existing student of GIBS and want to become an entrepreneur like you in the medtech industry. So he's asking about the future of healthcare in India.
Oh, I mean, from the opportunity perspective, for an entrepreneur or for a startup, it's great. Look at our population. So it's definitely negative side, but look at from the opportunity side, definitely positive. In healthcare side, when you develop these products and all, you have the base to test your product. A good population, good number of hospitals and all. So opportunity wise, market size wise, it's definitely we are heading in the right direction. And now if you look at the last 10 years, a lot of policies, government policies and all has also supported altogether the healthcare. But yeah, I mean, as a founder, I also believe that just do not think about India. I mean, if you really want to be a big company, always think global. You just use India as a base where you develop the product here at low cost, do your trials because a lot of data can come very quickly, do your early revenue, start scaling up. But I would say that, okay, go outside. There's nothing wrong. Why can't we export, or why can't we give services from here? So yeah, I mean, if you're really thinking as an entrepreneur, think global.
That's really a nice thought, sir. Which you said, they say no, be local, but think global.
Yeah.
Thank you so much for that. The next question has been asked by Arif Sheikh. Sir, can you mention that one thing which you feel is more risky in medtech industry when compared to the other industries?
Yeah, I mean, in medtech, there are two things. One is you have to go for the clinical trials. It takes a lot of time. You have to prove accuracy, sensitivity, or whatever the impact of it. It might not come when you do it. And number two is the regulatory approval, and it's keep changing time to time, which are not there in the other industry. So For example, if I make a product in India, I have taken the regulatory approval in India. But the challenges is I have to take regulatory approval in Africa also. I have to take regulatory approval in South America also. So from the regulatory point of view, it's challenging.
Great. Thank you so much for that, sir. The next question has been asked by Shanti. She says, what role did research and innovation play in the development of Janitri's medical devices?
What role?
Yes. What role did research and innovation play?
I mean, definitely we are a research and innovation based company. And if you look at our product, it's a multidisciplinary product, include hardware, sensor, signal processing algorithms, AI algorithms, on the software side, mobile application, front end, back end, UI, UX, industrial design. So it's a multidisciplinary product. So a lot of R&D has been done on developing the product. But apart from that, a lot of research has been done on validating the product as well, in terms of taking a lot of data from the patient, even doing the problem statement. So, I mean, we are an R&D company. Just to give you a figure, we have 15 patents filed. More than 5 has been granted already. We are a heavy deep tech R&D company.
Super. So that's really nice. Congratulations for that, sir, and many more to come under your patent list. So moving ahead with the next question, Sushma Nagaraj asks, sir, what are the advices to the youngsters who wanted to become an entrepreneur as it's trending now?
Oh, I mean, I always say to the youngsters specifically, coming out from the college or in the college, that if you really want to, you just try it because you have nothing to lose.
Absolutely.
Right? As soon as you start getting into jobs, family, marriage, then children, you start getting a lot of responsibility and the risk-taking capability goes down. So now as a student or as a fresher, I mean, if you have just a passion, you should try. Let's suppose you try for 1 year or 2 years. Either things will work out or not work out. If things will work out, well and good. If not work out, you have nothing to lose in terms of anything. But as an ex-founder or as an ex-entrepreneur, there are many people who are ready to take you.
Okay. Thank you so much for that, sir. Next question is being asked by Devjit. He says, what specific challenges have you faced as Janitri medical entrepreneur and how did you overcome them?
Many challenges. I mean, entrepreneurship and startup is all about challenges and solving them. But specifically on the medtech side, in India, as of today, we also do not have an expertise who actually have built medical devices. If you look at more than 95% of devices we are importing from outside. So there is no expertise lies in India in terms of R&D, specifically considering for example, now we are a software hub, right? You can find developers anywhere. So that kind of an expertise in India has, but when it comes to medical devices, we don't have. So finding those expertise was tough. Number 2 is that regulatory, information was not very much clear. What kind of a path it is, what kind of a class it is. So India is still evolving in terms of its own medical device regulatory norms. So still, but yeah, in last 5 years, we have seen a lot of growth and things are getting clear. But when we started, it was not very much clear.
Okay. Thank you, sir, for that. So Baisakhi asks, sir, what was your motivation?
I mean, motivation is to solve problem, bring an impact, but at the same time, build a big business. So there are 4 factors I really just consider myself to keep motivating me that, okay, I should be solving a global problem. It should be through deep tech. It should make an impact and it should make a business. So, I mean, these are the 4 factors. If coming to me, specifically now the mother and child healthcare, it keeps motivating me.
Great. So that's really nice, sir. And the next question has been asked by Darshini. Can you tell us more about your experience appearing on Shark Tank India and securing funding? How has this exposure impacted your business?
So Shark Tank India, it was a great experience. It was a lifetime experience, and it go through the multiple process of selection, and it is not scripted, for your information. You spend a lot of time, you pitch them, there's a lot of interaction happen for 1.5, 2 years between investor and you, but you only see 15 minutes. But overall, it's a great exposure. We managed to secure funding. But more than that, the air time which you are getting on a prime time, on a prime show, which you cannot define that in the value as a startup. So you get a credibility, immense amount of credibility. Suddenly the India knows you, and it straight away promotes your revenue. It straight away promotes your business, straight away promotes you as a good brand. So, I mean, it's a great show, and it's definitely going to help a lot of startups who are coming there.
Great, sir. Thank you so much for that. The next question has been asked by Karan Roy. Sir, we have a lot of questions, but probably we'll take up another about 3 questions maximum more.
Okay.
So the Karan Roy asks, sir, is there any situation in your journey where you had planned but did not work, and you had to re-strategize everything what you had planned?
I mean, not completely 100% type, but definitely there are few changes in the product, few pivot in the product on the feature level. Definitely, yes. And it keeps coming because you have to keep hearing from the customer, and it's a part of journey. But I mean, we have not done any sort of 100% re-strategization. I'll tell you, for example, we started from the contraction monitoring device, but eventually we become the fetal monitoring and contraction monitoring device. And eventually we become now a fetal maternal monitoring device. And now we are becoming the pregnancy and newborn monitoring company. So it is ultimately an incremental thing, but we have taken those decisions based on the stakeholders' feedback.
So it's more over like evolution, what you get into the process. Step on step, the evolution is must in every process.
Yeah.
So great, sir. Thank you so much for that. And Mr. Shreyas Kamath asked, Mr. Arun, can you speak about how much R&D is important to develop a product or a service? Should R&D be focused that much?
Yeah, I mean, if your product is an R&D focused product, now as a founder, you also have to define that. How many years you first want to give to yourself as an entrepreneur if you try. For example, as a medtech, I knew that, or based on the research, that okay, it will take minimum 4 or 5 years to develop a product from an idea to market. And if I say as an entrepreneur to myself, okay, no, I will just give the first 2 years to myself, then I think it is not okay. It is like, telling lie to yourself. So as a founder, you can actually decide, okay, in life, I want to first give 2 years to my entrepreneurial journey, or 3 years or 4 years based on that. And then also decide the industry. You do not really just need to be the R&D focused product. You can also be in the service focused. So it's purely depend on the industry. For example, drugs take 10 to 15 years. Medical devices take 4 to 5 years. App will take 1 day. So, you can actually define that and keep improving.
All right, great, sir. So we'll take up one last question. This has been asked by Professor Arnab Ghosh. Do you think more investment is bringing more responsibility as an entrepreneur in the startup economy?
Yeah, I mean, when investors also invest in you and your journey or the product, it's definitely bringing the responsibility. So in the early phase, I would say that investors invest on the team or the founder. It's not about the idea. That's a secondary. So if they first see, okay, founder is passionate or can figure out the way and all, ultimately they are betting on the guy, not really on the idea. But at the same time, then as a founder, it brings a lot of responsibility because now you have taken money from someone. And but I think I would say keep that aside. Now you have a resource. Start focusing more on building the business. Investors' pressure will be there, but keep that aside. I would say that. But just focus on building product, business, make it profitable, and you bring revenue in the company, and nobody will raise any question.
Okay. The investors are more keen on the benefits, what you can give it back to them. When they have trusted, obviously you will have to give it back to them as much as possible to them. Right?
Yeah, I mean, but at the same time, they have, see, ultimately it is a transactional, right? You have a story and they're believing in your story, and ultimately you are giving equity as a part of that transaction. And so you have to also take in that way.
Okay. All right. Arunji, one last question from my end. I would say, sir, what message would you like to give it to our audience of the day, where this is a part of IRE when we speak about innovation, research, and entrepreneurship, where you've been in your journey, all three are included, I would say, innovation, research, and entrepreneurship. So what message would you love to give it to our audience, and they can probably take aways for this session, sir?
So I would say that you have, as a founder, you have to be highly passionate for your idea. But at the same time, I would also say that we are not married to our idea. You do not get married to the idea. A lot of time what's happened, no, I will only keep doing this and this. I am married to this idea, and then things do not go well. So be also analytical that, okay, where things are going right and wrong. Do not only think about from your heart, because sometimes we just only think from there, okay, this is my baby. But yeah, do not think in that way. But I consider innovation is a very, very important and key factor if we have to grow. I even say that every day to my team, the day we stop innovating, we will die, which is very, very important. We have to keep innovating, and not just on the product side. So product side is one thing, but even on the company process side, company operation side, it can also be the business model side. It can also be the side how your end customers are getting to know about you. So innovation can come anywhere. It's just not on the product.
Absolutely, sir. Thank you. Thank you so much. I must say, Arunji, for joining us. Sincere gratitude from the entire GIBS family. Thank you so much for enlightening us in a lot of concept, which you got a lot of thought process, which got into create this amazing product. And I'm sure the entire globe would take the benefit of your product, and it would flourish like anything. Thank you, sir. Thank you so much for gracing us with your presence and delivering the insightful session on the today's topic. That's the journey and learning of a medtech entrepreneur. And I would also like to express my sincere gratitude to all the participants who have been actively engaged in this IRE talks. And Arun sir, we would love to have you in campus. Anytime you're available, we'll see to it that according to your schedule, we'll schedule one of the session in the campus as well, so that our entire set of students are also being benefited with your expertise in the medtech industry. Thank you so much, Arun sir. And I must say that Arun sir is highly active on social media. So you can stay connected with him on his to understand more on entrepreneurship. He's a very active person on various platforms to help in terms of mentoring, in terms of startups, in terms of innovation. So I'm sure you can take his guidance as well. So sir I'm sure would be able to help you out in all those things. And one last announcement, I would say, please note that all the previous and this webinar would also be put on the GIBS YouTube channel. So you can, in case if you want to revisit the this particular webinar, you can recheck on the GIBS official page, and the certificates of this webinar would be shared with all the participants on 9th of this month. That's after 2 days. And just for your information, the next IRE talk will take place on 18th of July. That's 18th July 2022 at the same time about 4:30 p.m. And we are featuring Mr. Gulsha Sharma, the founder of Falhari. I must say again, Shark Tank finalist, and where they had a complete venture on fruitful habit, and this has Shark Tank finalist. So thank you so much everyone for joining us. Thank you so much, Arun sir, for being with us and sharing your thoughts. Thank you so much once again.
Everyone. Thank you, Sandeep, for inviting, and all the best for everyone who is planning to start.
Thank you so much. Thank you so much.